Hi, my name is Mari. I'm a writester and I'm doing my bone video, the Axial Skeleton. First we'll start with the cranial bones. Here we have the frontal bones. Here we have the parietal bones. And in the back here we have the occipital bone. On the occipital bone we have the external occipital protuberance. This is where the muscles of the head hold the head upright and allow the back of the head to tilt. Looking at from the side, we have the temporomandibular joint, the mastoid process, the styloid process, the external acoustic medius, and the squamous part of the temporal lobe. For an internal view of the temporal lobe, I'll be showing you the petros, which is right here. In the petros, it houses the middle and internal ear cavities, which contain sensory receptors for hearing and balance. Next, we have the internal acoustic medius, which is right here. Now we'll be moving on to the syphnoid, which is located right here on the lateral side of the body. The external view, we have the superior orbital fissure, which is in here in the orbit. What runs through here are the cranial nerves that control eye movement, which would be 3, 4, and 6. On the internal view, we have the lesser wing, the greater wing, the optical canal, as well as the sella turcica, which is right in here. And we'll move along to the ethmoid, which also has internal views. The crista galla is this pointy thing right here, and the cribriform plates are right next to it. Okay, next we have the sutures. The first one we have is the coronal, which meets here at the frontal and the parietal bones. Then we have the sagittal, which is right here. It connects the parietal bones. Then we have the suture, the lambdoid, which connects the parietal and the occipital. Next we have the squamous, which is here on the lateral sides of the cranial that connect the parietal and the temporal together. We're going to move on to the facial bones. The first one that we have is the maxilla, which is going to be this part here, in between the nasal and the alveolar process, which would be where the teeth are. Then we have the nasal cavity here. We have the zygomatic, which is going to be what most people refer to as their cheekbone. The bones that make up the zygomatic arch would be the zygomatic process and the squamous part of the temporal. The ethmoid is going to be the top part of the septum here, as well as 2 flaps on each side. And then we have the vomer, which is the bottom part of the septum. The two bones that make up the septum are the vomer and the perpendicular plate of the ethmoid. The inferior nasal conch is going to be over here on the side in the nasal cavity. It increases the turbulence of air flowing through the nasal cavity. We'll move down to the mandible, which would be the jaw here. What we have is the body of the mandible. We have the angle of the mandible, which most people say it looks similar to a 90-degree angle. We have the ramus, which would be the long back part here. We have the mandibular condyle, which is right there. We have the mandibular notch, which is going to be this opening right there. And we have the coronoid process, which is right there. Next, we'll move on to the vertebral column. In the vertebral column, we have 4 curves of the adult vertebral column. The first one will be the cervical, which would be the first 7. Next, we have the thoracic, which will be the next 12. Then we have the lumbar, which would be 5. And then we have the sacral, which would be these fused vertebrae here. As I previously stated, the cervical has 7 vertebrae. The atlas, which is C1, articulates with the occipital condyles of the skull, which allows us to nod, like this. What's unique about the transverse process of the cervical vertebrae is that each process contains a transverse foramen through which the vertebral arteries pass to service the brain. So it allows functions and everything to go to the brain. The thoracic vertebrae, it has 12. I'm going to point out some different features on them. First, we have the spinosus process. Then we have the transverse process. We have the intravertebral foramen, which would be the space in between each vertebrae. We have the body of the vertebrae, and then we have the intravertebral discs, which would be these ridges that you see in between each vertebrae. And then we'll go back to the vertebral column, where we'll look at the lumbar region, which would be the last 5 vertebrae. The sacrum, which is here, has 5 fused vertebrae bones. And then right here at the very end we have the coccyx. Now we're going to move on to the sternum. There are a couple of bones that I like to point out on the sternum. We have the manubrium, we have the body, we have the xiphoid process, and we have the jugular notch here. While we're on the front of the skeletal system, we'll go ahead and do the ribs. We have 3 different types of ribs. We have the true ribs, which would be ribs 1 through 7. 1, 2, 3, 4, 5, 6, 7. And then we have the false ribs, which would be 8 through 12. 8, 9, 10, 11, and 12. It's good to note that ribs 11 and 12 are also referred to as floating ribs. I'm going to now point out the head, neck, and tubular part of the ribs. The head is the part that touches the vertebra. Next to that would be the neck. And next to that would be the tubercle. Now it's important to know how these articulate with the vertebral column. The head articulates with the vertebral bodies at 2 facets. One joins the body of the same numbered vertebrae, of the thoracic part of the vertebrae, and the other articulates with the body of the vertebrae immediately superior to it. The tubercle articulates with the costal facet and of the transverse of the same numbered thoracic vertebrae. This concludes my bone video on the axial skeleton. I will be back with you guys in just a few minutes with my appendicular skeleton video.